Hello, I'm Jonathan Ashworth, Labour's Shadow Health Secretary, and I wanted to say I'm sorry I can't be with you today at the Health Campaigns Together conference because I've got a family occasion I need to be at. But I want to send you this message to express my solidarity with you and to congratulate you all for the campaigning that you have done for our National Health Service. And I wanted to send you a Labour message to tell you that the Labour Party is committed under Jeremy Corbyn's leadership and with my role as Shadow Health Secretary to a universal, publicly provided, publicly administered and democratic National Health Service. Over the weeks and months ahead, I want to work with you on rebuilding a National Health Service there for everyone, public and universal. But I also want to work with you on the big challenges ahead that we have. At the last general election, Labour said we would allocate an extra £6 billion a year for the National Health Service. Across the Parliament for health and social care, we would allocate an extra £45 billion. But we know with the needs of an ageing population and the needs of a population increasingly reliant on a health service, when we know that people growing up in poverty, growing up in deprivation are more likely to have greater health needs, we're all aware that for the long term our NHS is going to need more investment. Many think tanks came out and said the money that Labour are putting into the NHS won't go anywhere near what is needed for the next 10, 15, 20 years. So I want to work with you on how we fund the NHS for the future. But I also want to work with you on our next big campaign, ending privatisation in our National Health Service. We know that privatisation destabilises the NHS and leads to greater fragmentation. I want to reinstate the NHS and bring an end to Tory privatisation. So in the months ahead, I want to work with Health Campaigns Together on how we analyse the extent of privatisation across the country and how we get our message across about a Labour government ending privatisation. We've been calling for an end to the public sector pay cap, and our priority in the last few weeks and months has been campaigning with trade unions and Royal Colleges, demanding an end to that pay cap, and it looks like we've got the government to agree to end that pay cap. But we are saying in the strongest possible terms that if the government do end the pay cap in the coming budget, then they have to find the money to end the pay cap. They cannot expect the NHS to find that money from their existing budgets. And of course, I want to work with Health Campaigns Together in the weeks and months ahead to campaign against cuts and closures as a result of SDPs or American-style ACOs. We were very clear in the general election campaign the Labour government would halt SDPs and we're against American-style ACOs. So I hope I can work with all of you on these campaigns as well in the future. And as Labour's next Health Secretary in the Jeremy Corbyn government, I don't want to just rebuild our National Health Service. I want to be a Health Secretary who takes on the severe health inequalities in our society as well. It's simply unacceptable that a child born today in the most deprived part of the country will not have the same life expectancy as a child born in the wealthiest parts of the country. So I'm announcing a big programme of action to tackle child ill health and improve the well-being of every single child. I want to invest in our public health infrastructure as well. And improving the public health of the nation is a top priority. That involves improving housing. It involves improving the air that we breathe. It means changing our benefits system. But it also means changing the law as well. We'll ban the advertising of junk food directed at children on family TV viewing. And I've spoken out quite personally about why we need to have a big programme tackling addiction in society as well. Again, I'm sorry I can't be with you today, but I express my solidarity with you. I wish you all a good conference and I look forward to campaigning with you in the weeks ahead. The Labour Party is committed to rebuilding our National Health Service, committed to reinstating our National Health Service, and we're going to fight for our National Health Service. We're going to fight for the NHS as if our lives depended on it, because quite literally, lives do depend on it. Have a good conference.